She paid Medicare taxes for 38 years. 38 years of watching that line item disappear from every paycheck, every quarter, without complaint, because that was the deal. You pay in, and when you need it, it's there. Then she turned 71, sat down in a dentist's chair, and walked out with a bill for $3,193. Medicare covered exactly $0 of it. That moment, a woman staring at a number she never planned for, is not an accident. It is the design. And before this is over, you're going to understand exactly what that design looks like, why it was built this way, and whether there's anything you can actually do about it before it's too late. 3 questions, 6 gaps, 1 system that depends on you not asking them. This channel is not affiliated with any insurance company, CMS, or government agency. What follows is general education, not legal, medical, or financial advice. Now let's get into it. The single most financially devastating thing Medicare refuses to cover isn't dental. It isn't hearing aids. It's the slow, grinding, years-long cost of needing help with the basics of being alive, bathing, dressing, eating, getting out of bed. Long-term custodial care. Medicare covers skilled nursing care for up to 100 days, but only after a qualifying 3-night hospital stay, and only for skilled rehabilitation, physical therapy, wound care, that kind of thing. The moment your condition becomes maintenance rather than recovery, Medicare's clock stops. Day 101-0. What does that actually cost? A private room in a nursing home runs $115,000 to $130,000 per year, according to Care Scout's 2026 data. Assisted living averages around $75,000 annually. And for someone with dementia requiring around-the-clock in-home care, a real figure pulled from a real family's experience, the number can reach $360,000 in a single year. The average long-term care stay is 3 years. Run that math, $250,000 to $400,000 per person. For a married couple, double it. The fallback plan most people don't know they're relying on is Medicaid. But Medicaid comes with a trap. Most financial advisors don't explain loudly enough. In most states, you must spend down your assets to below $2,000 or $5,000 before Medicaid will pay a single dollar. Your savings, your investments, your house, in many cases. And the 5-year look-back rule means that any assets transferred to family members in the 5 years before your application can be clawed back. You can't give your house to your kids on Monday and apply for Medicaid on Friday. Workarounds exist. Traditional long-term care insurance can help, but one comment from a viewer who tried to use it put it plainly. The insurer ducked and weaved every claim. Hybrid life insurance policies with long-term care riders are more reliably paid out. HSA contributions, if you're still building them, can fund LTC costs tax-free. But the most honest thing to say is this. The most liked comment on a competitor video about this exact topic read, "My plan is to die rather than go into a nursing home." That's not dark humor. That's a person doing the math and concluding there is no good answer, which means the time to start looking for a less bad answer is now, not when the diagnosis arrives. Back to the woman with the $3,193 bill. That number was for dentures. 1 set. Medicare Part A and Part B covers 0 dental care, no cleanings, no crowns, no extractions, no root canals, no implants, no dentures, nothing that happens in a dentist's office unless you're being admitted to a hospital for something else entirely. The costs are not theoretical. A single crown costs $1,800. An extraction costs $600. Dental implants run $3,000 to $5,000 each. According to KFF data, the average Medicare beneficiary spends $874 out of pocket on dental every year. The top 10% spend $2,136 annually. Those are the people with the most serious needs, which tend to compound with age. Here's what makes this gap genuinely cruel rather than merely inconvenient. Dental health is not cosmetic. Untreated gum disease is linked to heart disease, diabetes complications, and elevated stroke risk. Medicare will pay tens of thousands of dollars to treat the cardiac event while refusing to cover the $200 cleaning that might have helped prevent it. The mouth is connected to the rest of the body. The insurance system has just decided to pretend otherwise. The workarounds are real but limited. Medicare Advantage plans often include dental benefits, but read the fine print. Annual maximums of $1,500 to $2,500 may not cover a single major procedure. Standalone dental plans run $45 to $55 per month. Dental office in-house membership plans, offered directly by many practices, typically cost $350 to $450 per year and include cleanings plus a 20% discount on procedures. They're worth asking about. Now here's where the stakes get higher than most people realize. Medicare will pay for a diagnostic hearing test if a doctor orders it. What it will not pay for: the hearing aids themselves or the fitting exam that makes them work. Prescription hearing aids cost $2,500 to $7,000 per pair. Costco sells a well-regarded pair for $1,600 to $1,800 with a 180-day return policy. Over-the-counter aids for mild to moderate loss, made available by a 2022 FDA ruling, run $200 to $1,500. 1 in 4 adults between 65 and 74 has disabling hearing loss. By age 75, it's roughly 1 in 2. These are not edge cases. But the real reason this gap matters more than the price tag: a man's family watched him grow confused, distant, unable to follow conversations. He withdrew from dinners. He stopped engaging. His family began preparing for a dementia diagnosis. It wasn't dementia. He couldn't hear in certain frequency ranges. A hearing aid changed his life within weeks. Untreated hearing loss doesn't just isolate people. It can produce symptoms that look indistinguishable from cognitive decline, leading to misdiagnosis, unnecessary medication, and the kind of social withdrawal that accelerates genuine cognitive deterioration. The gap in coverage doesn't just cost money, it costs clarity. Workarounds. Costco specifically is worth naming. The quality is high, the return policy is generous, and the price is roughly half of a private audiologist. Some Medicare Advantage plans include a hearing benefit. OTC aids are now a legitimate option for mild to moderate loss. This next gap almost nobody thinks to ask about until they're already on the plane. Original Medicare pays nothing for medical care outside the United States. There are 3 narrow exceptions: emergencies within roughly 60 miles of the Canadian or Mexican border, and incidents aboard a ship in U.S. territorial waters. Beyond that, you are on your own. Picture a 68-year-old 2 weeks into a European river cruise, a cardiac event. Medical evacuation alone, just getting the person onto a plane with a medical team, can cost $50,000 to $100,000. Hospital care abroad is billed entirely out of pocket. Travel medical insurance for a 2-week trip costs $150 to $300. That's less than a single dental cleaning in some American cities. Medigap plans C, D, F, G, M, and N include a foreign travel emergency benefit, but it's capped at $50,000 lifetime with a $250 deductible and 20% coinsurance. Medicare Advantage plans vary widely. Most cover only emergency stabilization. The fix here is among the simplest on this list. The gap persists because nobody asks, and the broker selling the plan didn't bring it up. Vision is the gap that looks smaller than it is, and that's intentional because it is smaller than the others. Medicare does not cover routine eye exams, glasses, or contact lenses. It does cover medically necessary eye care, cataract surgery, glaucoma treatment, macular degeneration, diabetic retinopathy. That distinction matters, and it trips people up constantly. Many retirees assume their annual eye exam is covered. It isn't, unless the doctor discovers a medical condition during it. Average out-of-pocket vision costs run about $194 per year on Medicare Advantage and $242 on Medigap. Manageable but cumulative. Workarounds are genuinely accessible here. Medicare Advantage plans frequently include vision benefits. Standalone plans run $10 to $20 per month, and retailers like Costco Optical and Warby Parker can dramatically reduce frame costs. This gap is the most fixable on the list. The last gap sounds almost trivial until you follow it to its logical end. Medicare does not cover routine podiatry, nail trimming, callus removal, general foot care. It does cover foot care when medically necessary, and here is the exception that matters: Diabetic patients with peripheral neuropathy qualify for covered podiatry visits. Given that roughly 1 in 3 Medicare beneficiaries has diabetes, this exception is not small. For everyone else, routine podiatry runs $50 to $150 per visit. A commenter put it plainly, "How come Medicare doesn't cover podiatry services? Older people always have problems with their nail clippings." It sounds almost funny, but untreated foot problems in seniors lead to infections, falls, and hospitalizations, which Medicare will then pay tens of thousands of dollars to treat. If you're diabetic, get the qualifying diagnosis documented by your primary care physician before the podiatry visit. That single step changes what you owe. So what do you actually do with all of this? Not a list of products, a decision logic. Start with the catastrophic exposure, long-term care. Understand the Medicaid spend-down rules and the 5-year look-back before you need to. Talk to a fee-only financial planner, not someone selling you a policy. Then address the near-certain costs, dental and hearing, by pricing real coverage with actual benefit limits, not $500 annual maximums dressed up as benefits. If you travel internationally, even once a year, travel medical insurance is not optional. If you're diabetic, document it. Vision is the most manageable gap on the list. Shop smart, and it largely solves itself. Now go back to the woman with the $3,193 bill. She paid in for 38 years because she believed the deal was real. It was, just not the deal she thought she was making. Medicare was designed in 1965 for a specific kind of sick, acute, hospital-based, short-term, a broken leg, a heart attack, an appendectomy. Everything on this list, the dentures, the hearing aids, the nursing home, the flight home from Portugal, is chronic, gradual, and expensive in ways that 1965 never anticipated. She wasn't careless. She wasn't naive. She simply wasn't told what the gaps were. Neither were most of the people watching this. Now you are. What you do with that is the only part of this equation you actually control.